Turmeric is a spice derived from the turmeric plant, and curcumin is the yellow-colored primary active ingredient, and both turmeric and curcumin have been claimed to improve artery function, treat prediabetes, and prevent cancer and Alzheimer's. But when you look at the scientific literature, does it really live up to all of its hype? Well, in this video, I'm going to dive deep into turmeric's claimed health powers and classify it as either helpful, harmful, or just a plain hoax. What's up, superhumans? If you are new here, my name is Dr. Tessa Spencer. I'm a licensed and practicing pharmacist, as well as a NASM certified personal trainer and nutrition coach. And my goal for this platform is really to inspire, to educate, and empower you in creating this dynamic and fulfilling life using sustainable, evidence-based health and wellness practices. Now, if you find this video helpful, make sure to give it a like, share it with those who could utilize this knowledge, because I really think this information could help a lot of people. Also, if you want a personalized supplement protocol kind of tailored to your health and needs, make sure to click the link below in my description and book a free wellness consultation where I will be answering your questions and providing solutions for your healthcare needs. Finally, it's super important to note that natural remedies, supplements, and superfoods can all interact with medications or certain disease states, so make sure you talk with your personal healthcare provider and your pharmacist before supplementing with anything. So with that, let's dive into the first claim of turmeric, which is improving artery function. The endothelium is the inner lining of our blood vessels, and if we don't take care of it, endothelial dysfunction can set us up for heart diseases or having a stroke or a heart attack. Researchers in Japan recently compared the endothelial benefits of exercise versus curcumin to see which group improved their endothelial function more. For 8 weeks, they compared a teaspoonful of turmeric to daily exercise, and the exercise group significantly boosted their endothelial function, but so did the turmeric group. And the magnitude of the improvement achieved by the curcumin treatment group was comparable to those obtained from the exercise group. Therefore, regular ingestion of curcumin could be a preventative measure against cardiovascular disease, especially in postmenopausal women. Furthermore, their research suggested that curcumin may be a potential alternative to the treatment of patients who are unable to exercise for any sort of reason, but ideally you would want to do both to kind of boost that endothelial function. If you want to learn about other things that you can be doing to kind of lower your risk of heart disease or experiencing a heart attack or stroke, check out this video right here, which is linked below in the description. Alright, so one for one, but what about the claims on preventing cancer? Curcumin, present in the spice turmeric, is one such agent that is currently under clinical investigation as a cancer chemopreventive. Basically, they're trying to look to see if it's gonna prevent cancer as opposed to chemotherapy, which is used to treat cancer once it is spread. According to their mode of action, chemopreventive agents are classified into 3 different groups: anti-proliferatives, antioxidants, and carcinogen-blocking agents. Curcumin belongs to all 3. A study back in 1987 investigated the effects of curcumin on the DNA mutating ability of several different toxins, and they found that curcumin was an effective anti-mutagen against standard cancer-causing agents. But this was in vitro, meaning that the test was performed in a test tube. So what about the results in real, actual humans? Well, it's kind of hard to find people who would voluntarily expose themselves to cancer-causing agents and carcinogens, so the best population to kind of ethically study this is in smokers. If you have non-smokers ingest or eat turmeric for a month, nothing really happens. But if smokers eat turmeric for a month given at doses of 1.5 grams per day, it significantly reduces the urinary extraction of mutated gels in smokers just 15 days later. And this was just plain turmeric, the ones that you could buy in a store, and less than a teaspoon a day, indicating that dietary turmeric is effective in preventing our cells from mutating in ways that we don't want them to, which then can lead to cancer. Okay, so 2 for 2, but can it treat diabetes? An extraordinary study was published in the Journal of American Diabetes Association. Curcumin extract for the prevention of type 2 diabetes. A randomized, double-blind, placebo-controlled trial of folks diagnosed with prediabetes. Half of them got to supplement with curcumin curcumin, and the other half got placebo pills. And basically they just followed them for 9 months to see who ended up with diabetes. After 9 months of treatment, 16% of the subjects in the placebo group went on to get diagnosed diabetes. But no one from the curcumin group was diagnosed with diabetes after the 9 months. The curcumin group actually saw significant improvements in fasting blood sugars, glucose tolerance, in hemoglobin A1C, insulin sensitivity, and pancreatic beta cell function, which is just crazy. Another study showed this turmeric spice compounds may have an anti-diabetic effect by decreasing fat in our blood. The pre-diabetes study used an equivalent of like a quarter cup of turmeric a day, whereas this used only about a teaspoon's worth, which is pretty doable in diet rather than taking a supplement. Okay, so 3 for 3. I bet you can guess what I'm about to say about curcumin and turmeric in the prevention of Alzheimer's disease. I will say that there isn't as much quality research. 1,000 people were tested. Those who ate curry often had about half the odds of showing cognitive impairments after adjusting for a wide variety of potential confounding factors. Turmeric, one of the main spices in curry, so this kind of says that the consumption may be associated with a better cognitive performance. I would say that this claim for turmeric definitely has the least amount of evidence, but I would say that the evidence is still promising. So now that I've kind of established the many health benefits of turmeric and curcumin, does this mean that we should be getting these agents from our diet, or should we be supplementing with them? A group of researchers at the Anderson Cancer Center in Texas pitted curcumin against several different types of human cancer cells, and they found that the whole food spice turmeric is more potent compared to curcumin alone. Although curcumin is believed to account for most of the health activities of turmeric, researchers over the past decade has indicated that curcumin-free turmeric is just as effective, if not even more effective, than curcumin-containing turmeric. Now, if you want to learn how to choose a safe and pure supplement to kind of avoid paying for expensive, potentially contaminated products, check out this video here, which is also linked below in my description. So just incorporating turmeric into cooking may be better than taking curcumin supplements, especially during pregnancy. The only other really contradiction to taking turmeric was the potential to trigger gallbladder pain in people with gallstones. Too much turmeric, although, can increase your risk for kidney stones, so even though the consumption of moderate amounts of turmeric would not be recommended for someone with a tendency to get kidney stones. In addition, turmeric and curcumin has low bioavailability when ingested. However, taking it with a little bit of black pepper can really increase that bioavailability and allow it to have all of the health benefit effects on our body as possible. Overall, by this point, you can really probably guess how I feel about turmeric and classifying it, and yes, I'm classifying it as helpful. And the best thing is that you don't have to pay for some fancy expensive turmeric powder. I literally get my organic turmeric powder from the grocery store for like less than $3. Now, if you want to learn about more superfoods and supplements that do have a clinical benefit and could be really helpful to your personal health, I do offer personalized supplement protocols for helping people go through being confused and paying too much for supplements that don't work to confident and reaching their health goals faster. Make sure to book a free wellness consultation with me today using that link below in my description. I'm also taking on coaching clients for my personalized wellness programs, which encompass personal training, nutrition coaching, supplement consulting, and overall disease management to help you go from feeling overwhelmed, fatigued, and confused about what you need to do to get real results to self-efficient, energized, and achieving your health and wellness goals. Whether it's improving overall health, increasing strength or endurance, losing weight, increasing energy, decreasing stress, or managing a specific disease or condition, or all of the above, my step-by-step personalized wellness programs are backed with proven results. Ready to hear how I can help you in your health journey? Once again, click the link below in my description to book a free wellness consultation with me. Now, if you want more day-to-day health and superfood tips and tricks, make sure to follow me on Instagram at the Superfood Pharmacist. And if you like this video, make sure to give it a thumbs up, subscribe to my channel, and share it with anyone who you think could benefit from this information. If you have any questions, make sure to put them below in the comments. Thank you again so much for watching this video. I hope to see you in the next, and until then, keep living your worth.